management team at Taylor with their benefit offering, and we're going to go over the 2019 benefit offering for you guys. The good news for you is you'll find not a lot of changes, and the changes that you will see are enhancements. So Taylor made a conscious effort to continue to offer a high-quality benefit offering for you, and they wanted to offer enhancements. And the other thing that should be congratulated on, because I want you to know that the cost of offering health insurance and other benefits we'll go over is very expensive. And unfortunately, Taylor was facing and did face a fairly substantial increase this year, and they chose to pretty much suck it up at the company level. So as an employee, you'll see a very modest increase in the amount you pay, but I just want you to know that's nowhere near the increase that Taylor had to bear. Okay? The stuff's expensive, and employers want to continue to offer, but we did have to make a few minor changes to make this thing fly. So we're going to go over, in case you don't know, this young lady actually works for you. She doesn't have the orange shirt on.
I have it in my bag.
She works, Kirsten is part of the HR team up at Salem. Chris Bass was here last year. She works with Chris. And he's real. So anyway, United Healthcare people were here last year. They couldn't make it, so I'm going to pinch hit for them. And then we did make some changes on the dental and vision enhancements, so I'll go over that as well. And we added a couple new benefits. We'll go over the life insurance and benefit that we've added, and the accident benefit that we've added, that are both voluntary. You choose, you pay for it, so we'll have premium information, and you just have to make a decision if you want to do that. And then finally, we're going to go over the open enrollment process. How many of you use, probably not too many, the Flock system, which is the online open enrollment? Okay. We're going to try to encourage you to do that. If you can't, Kirsten put together a paper form where you can check what you want, because this is the time of the year where you can rethink how you're enrolled on the medical plan or the dental plan or any of the plans. So we just need to get clear instructions from you if you want to enroll or you want to waive. So Flock, which is the online benefit administration system that you guys have, you can do that through Flock. So everything I'm going over today, if you register with Flock, you'll be able to see all that information on Flock. But I did bring hard copies of everything in case you don't want to deal with Flock. Does that make sense? Okay.
Is the Flock website in here somewhere?
Yep.
I think it is.
It should be. If not, you guys can just shoot me a call or an email and I can get it to you.
Yeah, Flock, just so you know, Flock's not an insurance company. Flock is a software provider that Taylor uses to kind of facilitate.
This one.
We'll take the stack, pass it on.
So it gets loaded with all the insurance information. It has your information, it has how you were currently enrolled. You can look at it and say, hey, I'm enrolled this way, and that's fine. I want to continue that way, and you check a box, and away you go. Or you want to add a spouse or delete a spouse, or whatever the case may be. So United Healthcare is going to continue as your medical plan. We're going to go over a bit about United Healthcare in a general way, and the options that you have to choose from really haven't changed a whole lot, but we'll go over again for review. You have three different options. One's a higher deductible, $3,000. One's a lower deductible, $1,000. And then we have two different styles of United Healthcare plan. One of them has a wide and vast provider directory here in the Sacramento area. All the hospitals participate. It's a pretty free and open plan. You pretty much can go wherever you want. That would cost you a bit more. And then there's another one that's fewer providers, but still probably 80% of the providers on both panels. So you still have a lot of folks to choose from, and that was quite a bit more reasonable. So we'll go over the financial part. Yeah.
Do any of these plans offer pet insurance?
No.
Okay.
That's a good question, though. I just did pet insurance sort of nationwide. They're on your side, you know, the TV guys. They actually do that, and I just didn't bring bringing up Taylor Management, nobody asked, but that's something an employer like Taylor just signs up, and then the employees get a link, and you do it or not do it. The only thing Taylor has to be able to do is handle the payroll deductions.
Okay.
So this group signed up, and they asked if it covered horses, and we did the research. And just so you know, cats, dogs, gerbils, rats, whatever, no horses. You got
No
a
livestock.
horse on your own.
No livestock.
Horses,
No
livestock.
here. You don't do that. The Nationwide will cover your dog, and if you want, I'll
not my
give you
cat.
one to cover. So
Yeah, it's
we are
mostly
changing
cats,
the dental
dogs,
plan. We're making
gerbils.
enhancements. The plan and really will work the same. And we'll get into details, but there's enhancements, and then the good news, that's an employee paid benefit. So all of you that are on it, your premium's going to go down by about 25%. Plus,
Awesome.
we'll go over some enhancements. Okay? So that's basically what we're going to do. So real quickly, again, United Healthcare, the new rates go into effect January 1st, 2019. So hopefully everybody prior to like the first week of December can let Kirsten know either by doing this form or going on the flock what you want to do. Okay? Because if you don't get everything in time, then it jumbles up the whole transmission, because eventually we got to communicate to the carriers who's enrolled, how they're enrolled, they're dropping or whatever. No. So we're going to continue to offer the 3 medical plans. We'll go over them in not a huge amount of detail, but we'll go over them. They really haven't changed for this year. I don't know if it's a big thing, but all 3 of the plans include alternative care riders. So if you have an inclination to go to a naturopath, chiropractor, acupuncturist, and massage therapist.
That's new, right?
You know, it's up there. I thought it was on the thing last year, but
Yep, it's currently on your benefit.
Oh, wow.
so they do they have naturopaths here? They have them in Oregon. We got a lot of stuff in Oregon, you know.
Keeping it weird.
Okay. So you can actually look on the United Healthcare Network. I brought a little flyer on how to
Should be with
look for doctors. So one of the things I'll tell you is, when we go over these plans, it's important for you to understand that you do have a network that you need to use. So you should try to figure out if your doctor's participating in the network. And if you want to go to a naturopath, they're also listed in there.
Sweet.
So in Oregon, and I think it's the same in California, a naturopath is considered equivalent to a regular medical doctor. So if you want to use that as your primary doctor, you can do so.
You just have to make sure that they are set up as a PCP.
Right.
Some naturopaths are just a naturopath and not a PCP. So you have to make sure that they're both.
So I would call United, and they should be able to tell you.
So would you have to set them up as your PCP?
No, United has to set them up, and then you can choose them. That's what it
Okay.
boils down to.
But if you look at the listings on there, you can request it.
You could, but then the naturopath would have to jump through some hoops. So it's up to them if they want to do that. I don't think United would care one way or another, but they definitely, as Kirsten said, you have to make sure United recognizes them as a primary care physician.
You can have them both.
Well, if they're not a primary care physician, then they would fall under this rider, and you could still have limited access. So this rider essentially gives you a $1,500 pool of money to use for either a naturopath, chiropractor, acupuncture, or massage therapy.
Nice.
And it's roughly $50 to $75 a visit, so you're looking at 20 visits of any of that stuff. But if you pick a naturopath that actually is recognized by United to be your primary care doctor, then you can go see that naturopath just like you would any other primary care doctor. It wouldn't fall under this limitation.
Oh, wow. Cool.
Does that make sense?
Yeah.
It does make sense.
Okay, couple of insurance terms you'll see in our presentation that we make purposely obscure so you don't understand what they're about. Deductible, everybody understand that deductible means the part you pay before the insurance company. So I say $3,000 deductible, $1,000, you're paying 100% of that before it kicks in. Out of pocket, that's the worst case scenario. So if you get hit by a car or you whatever have black lung disease, there'll be a number in the summary plan description that says you'll pay this much and that's it. So you have to understand that number. Affordable Care Act, i.e. a term Obamacare, the technical name for it is the Affordable Care Act. Under the Affordable Care Act, it's required that an insured health plan like United Healthcare cover preventative services, and they list out what the preventative services are at 100%. So each of you, depending on your age and gender, have access to preventive services. Won't cost you anything. So I highly recommend, if you haven't had a physical lately or haven't done any kind of wellness type of check, you should do so. It won't cost you a dime. And that's a every year type of benefit. So every year it's different things you can do for 100% coverage. Urgent care versus ER. I think everybody knows it's super expensive to walk into the emergency room, but if you do need to go, by all means go. But if you can go to urgent care, and you'll find those in the United websites as well. They're generally part of a clinic, or they can be a freestanding urgent care. It's a $50 copay, and they're open generally up until 8 or 9 o'clock every night, and reduced hours on Saturday. So it's not 3 o'clock in the morning you're going to have to go to urgent care, or emergency room.
Right.
But if you can go to urgent care, it makes financial sense for you to do so. They won't be able to handle things. If you think you have a broken leg, or you cut yourself, or you burned yourself, you can go into urgent care. But if you think you might be dying of a heart attack, they'll probably send you to the emergency room anyway.
Right.
In-network, out-of-network. So we talked a bit about going to the United Healthcare website. They have cute names for their networks. So it's important that you guys understand it really makes sense for you to use a network provider. Now you can go out of network in one of the plans, but you'll find it's punitive financially to do so. So I would not suggest you do so unless it's just you can't get care otherwise. High level, the three options haven't changed. The base plan, what we call the base plan, is a $3,000 deductible, $6,200 out of pocket, a $35 copay, so that's not subject to deductible for a visit to your family doctor.
Which project?
If you want to go to a specialist, it's a $70 copay. Urgent care is a $50 copay. Diagnostic and lab work, it's 20% co-insurance. They pay 80% of the bill. You pay 20. They waive the deductible. So if you have $200 in lab work, you can pay $40. Inpatient surgery. So if you go into a hospital and you have an inpatient surgery, I think that's our slide is not correct. I think it's a $250 copay plus the deductible plus 20%. Any way you look at it, it's going to be a lot of money if you have inpatient surgery. And if you go in and have an ER visit, so instead of going urgent care for $50, you go into the emergency room. It's $150 up front, and then they cover 80%, but you pay 20%. I guarantee you can't walk into UC Davis downtown and not have a $3,000 or $4,000 bill. So do the math. You'll be at least $600, $700, $800.
And it's also 20% of what the schedule is for the insurance company, right? So
Correct.
if the hospital's trying to charge you more than you're liable.
Yeah, so long as you use a preferred provider, which Davis is, then you get the reduced amount. But it's still a lot of money.
Yeah.
So this is a bit more detailed.
I can't read this. I can't read that.
Maybe you should be in the
So
front,
the
old man.
buy-up plan, the first buy-up plan, it buys down the deductible $1,000, and you can see the out-of-pocket's lower and the copays are lower. So everything is a bit more robust as far as how you're covered. It's better. And then the third plan, the choice plan, eliminates the narrow network, so you have a broader network, and we'll get into kind of the other differences between the two. But effectively, what you're purchasing when you go that route is freedom to see pretty much any physician you want. Does that make sense? So you're paying for that privilege. This is more details than you probably need to know, but it didn't really change. But again, you can see across the board, as you move from left to right, the copays go down, the out-of-pocket goes down. Things are just covered differently. The one thing I will point out is the prescription part is covered the same on all three plans. So United uses a tier, we've used in our spreadsheet generic brand and compound. They use tier 1, tier 2, tier 3. So again, you go to their website, and we can give you that address. If you have any concerns about, I'm taking XYZ prescription, is it tier 1, tier 2, tier 3, it'll be listed on their website. If you can't find your prescription on their website, that means they probably aren't covering it, and we have to talk to United, and your doctor gets involved, and there's usually another drug that does the same thing that they do cover. But you probably would know that by now if you are taking a prescription they're not covering.
Sure, yeah.
So the copays are $15 for tier 1, $30 for tier 2, $50 for tier 3. Again, not subject to the deductible. You just pay that copay when you go to the pharmacy. If you want to do their mail order program through their own company called Optum, then you have your doctor set you up on a 3-month refill scenario, and usually 4 of those are done at one time. And you set it up through Optum, and they just mail you a 3-month supply. You do save a bit. You save a half a copay. So if you're in the $30 category, instead of $90 for a 3-month supply, it would be $75 for a 3-month supply. And you don't have to go to the pharmacy. It works well if you have a prescription for blood pressure or something you know you're going to take all the time. It doesn't work well if you get a cold and you need an antibiotic. You don't set it up on mail order.
I don't see that slide in this package.
That
I
doesn't.
see part of that slide in here.
So this is not actually, the PowerPoint is different. This is for you to keep.
Right.
So we have prepared something for you to use as a reference. So all the information is in here, but it doesn't follow this PowerPoint presentation. So this is just basically laid out differently.
I think it's on page 3.
I don't see the third item. Choice.
Oh, yeah, you're right.
It's right here. What's on another page?
It's on the back side. That's right. So it's showing you your in-network and out-of-network options. So that's why it's separate from that third page. So it's on page 4.
So this is choice?
That's the choice option. Choice Plus Network at the top,
And that's the higher price plan.
the higher price plan, and then the other 2 options we did side by side, because there was only, it's the same basic plan with 2 different deductibles. So option 1, option 1, option 2, and then on the next page is option 3.
So, just, I want to make sure I understand. So, like, for any of the plans, say you go get an MRI, you're going to pay the deductible of, for example, for the buy-up, you're going to pay $1,000 and then 20% of whatever the cost would be?
No.
So that deductible is a yearly annual deductible.
Okay.
So that $1,000 you're paying on.
Yeah, but you're right on that. So if you get routine diagnostic, it's different.
Right.
If you
It's
get
20%.
MRI or CT scan or PET scan, yeah, it's 20% after the deductible.
Of whatever the cost is of the same. Okay.
United actually has a pretty cool, if you need something like that, you go on their website and you can search the various costs and providers near you. And things like an MRI, you'd be surprised it can vary 100% from one provider to another.
Wow.
On this
I know it
card,
works.
it says it's $50 for the United Healthcare.
That's for the urgent care.
Oh, for urgent care. Oh, I'm sorry.
Yeah.
No.
Yeah, so
Sorry
in
about that.
Portland, for example, a basic MRI, like you hurt your shoulder and you gotta get an MRI,
Right.
it can be anywhere from $600 to $1,600.
Right.
And United actually posts that, so depending on how you feel about it, you could find out why the 600 one is so much cheaper, and if you're comfortable with it, then it's going, most of the time it would be going towards the deductible, so in effect you are paying it.
Even within the same provider like Sutter Davis, Sutter Sac, I understand there's differences.
It could be. On the MRIs, I know that there's standalone places that do an MRI, and there's ones that are attached to a hospital, and generally the ones attached to a hospital are more expensive.
Because I know I talked about a routine colonoscopy with doing it in Davis and in Sacramento. And they said, oh, you can have it done cheaper.
Yeah, and the other thing is the
Sacramento.
colonoscopy is actually, If it's routine and it's just age related, you get to a certain age and you're supposed to do it.
Right.
Good luck, by the way, that's real fun. That's covered,
Yeah.
that's covered under the preventative services.
Yeah, it should.
Thanks.
Right, but I'm just saying with the
Me
other
too.
provider, and nothing to do with United, but I'm just saying with Sutter Health, it
Yeah.
worked that way, so.
They charge what they think they can get away with.
Yes,
is what it
exactly.
boils down to.
Shop around.
So anyway,
So, sorry.
so those are the 3 plans that you had last year. They're the 3 plans you had to choose from. What I thought I'd take a bit of time is to explain the differences, not go over all the different copays. All this is on Flock, right? Plus it's in here. It doesn't follow our PowerPoint to the T, but all this information that I'm going over in the PowerPoint is in our guide.
Yeah.
The first 2 plans utilize the Navigate network, and you have to choose a primary care doctor, so you have to designate somebody. And I know all of you that are enrolled on it went through that process because you had to.
Yeah.
But anybody that's thinking about enrolling on that plan or you're new to Taylor, what that means is when you go to the website and you look up, where's one of our little handy dandy? Well, I gave you a handout that shows you how to look up a doctor. When you find a doctor you like and you call their office and they're taking new patients and it's close to where you live or whatever, and that's who you want to use, when you enroll on the Navigate plan, yeah, that one. So you go to the United website, and the network is Navigate, and there's several networks that have the word Navigate in them. Don't use the one that's Navigate Plus, use the one that just says Navigate. There'll be a number, like a code for the doctor, and you have to put that code in on your enrollment form. Guess what? Kirsten has a space for the code on this paper form. So once you have a doctor, you can change them every month if you want. They don't care.
Okay.
So you can, again, try them out. If you like them, you keep them. If you don't keep them. But administratively, they have this wacky rule that says if you do it by the 15th of the month, they change it the first of the following month. But if you do it from the 16th on, then you have a 1-month lag. So just be aware, you just can't tell them today I'm changing the doctor so-and-so and it's tomorrow kind of deal. So there's a process. The other thing is if you enroll with a family on the Navigate plan, and you have a spouse, you have children, each person has to actually choose a primary care. So it doesn't have to be the same person. You obviously pediatrician for the kids. The spouse will probably want a different type of doctor for primary care.
Right.
One of the glitches, does anybody have children or spouse that doesn't live in the SAC area, like live out of state? Anybody have kids going to school out of state? College? Okay. If you're in that situation, the problem with the Navigate plan is, so I'm living here in Sacramento and my kid's going to school in Oregon. I want to add them to the plan. They have to choose a primary care doctor in this area. So we're telling folks, don't consider to Navigate if you're in that situation because that's crazy.
Ridiculous.
If your kid's in Oregon going to school, you don't want to have Dr. So-and-so here in Folsom or Rancho Cordova be the primary doctor.
Unless it's Corvallis.
Yeah,
As long as it's
probably.
Eugene, we don't care.
Well, either way, I didn't go to either one. I'm from California. You would have to use the broad choice plan, the broad network plan, the option 3 that you pay more money, doesn't have the requirement you pick a primary care. You don't have any requirements around anybody in your family picking a primary care. So if you're in that situation, that's the plan you would want to take.
So, does that mean that you could go to one doctor one time and just go to another one another
Correct.
time and not have to worry about any of that?
Yeah, that's when you're on the third option.
Like,
The ones that's broad choice, that's more expensive, so you're paying for freedom.
yeah.
basically.
Paying for treatment.
So again, the Navigate plan. So how many of you guys are enrolled on United Healthcare? I didn't think everybody was, but
How much are,
no, how many are enrolled right now?
You are too, Tyler, just not your eye.
So if you're enrolled on the Navigate plan, you already know this. If you're not, and you're thinking about enrolling, or you're thinking about changing from the broad choice to Navigate, again, Navigate understand it's a slightly narrower network. Usually not on the hospital side, but on the physician side, about 80% of the physicians will participate because they have to take an extra haircut on financially, so some of them don't want to do that. You have to pick somebody as your primary care physician, or United will assign one to you. You don't want to do that because then you won't know who they, well, you would know, but it's just nasty, so you want to pick somebody.
Yeah, it's a gamble.
You can change every month, and once you tell them you want to change, it'll be, like I said, either 2 weeks or 6 weeks before it's effective. You can change, you can pick somebody locally, or if you want to pick somebody that's out of town, that's fine. But then the dependent thing, like I told you, if they, what we were told was out of state. So even if you had kids, divorced living somewhere else in California, you'd be fine. But it's when your kids are living out of state and you're trying to cover them, then it gets a little nasty. It's kind of stupid. United really didn't have a good reason why it was that way.
Yeah, we're hoping to change it.
So again, important for you, regardless of what plan you're on, but understand the network. So the Choice Plus network, that's the broad network. So if you pick that choice, that's the one you would search under. The Navigate network, if you're choosing the Navigate plan, that's where you would search. You can search hospital facilities, you can search physicians, you can search outpatient types of facilities like the MRI places. They're all listed in that directory.
Kyle, you had them pick a doctor for you, and then when you called the doctor couldn't see you because they were full of patients, right?
That's exactly
Yeah,
what happened.
so typically what I tell folks is just because they're on the United directory doesn't necessarily mean they're accepting new patients. Most doctors do, but if their practice is full, their practice is full, and they won't take you.
Yeah.
So it behooves you to make a call and say, hey, I'm going on this program, you're part of the program, are you taking new patients, can I schedule my physical so we can get introduced?
Right.
They say, yes, you're golden. They say, no, go to the next one.
Yeah,
Yeah.
it takes a little legwork. That's why it's good to pick your own doctor. Like,
I had to go through about five different doctor's offices to get one. So.
Could be you, though.
could be. Mutual, we don't want
Conspiracy.
Damn, that guy.
Trying to get you to.
So the other thing with the Navigate plan
Upgrade anyway.
is it's somewhat like Kaiser. I think this is their version of Kaiser. So your primary care doctor, in theory, is going to get to know you. When you go in and the primary care doctor says, we can't handle this, we need to refer you to XYZ specialist, they're supposed to, United Healthcare says they train them to understand what they're supposed to do, i.e. they're supposed to log a referral. I want this person to go see an orthopedic surgeon for this, whatever ails you. But you have to make sure that they do that. And we did have a case where the Taylor employee didn't really do anything wrong, but the doctor was basically not the sharpest tool in the woodshed, and they messed up the referral. We're still unwinding that, and we'll probably end up, that'll work out fine because I think United realizes that it wasn't the Taylor employee, it was their doctor. So at the end of the day, my understanding is if you set up a MyUHC account, so if you register with MyUHC, that way anytime you want, you can go in and see how much of the deductible you met, you can see how your claims were adjudicated.
Oh, wow.
You can also see the referral. So if you went to your primary doctor and says, hey, you got to go do this, and I'm sending you to Dr. So-and-so, it'll show that the referral's been made, because honestly, before you go to that doctor, you best be understanding that the United Healthcare doctor has done their job.
Right.
And that's what this person didn't understand. It really wasn't her fault, but she just went and got the work done, and now we're dealing with the back end where the doctor's saying, oh, I didn't understand how to do that referral thing. Well, that's part of their job, and United knows it. Anyway, that's how.
And you should be able to access that through like app and everything.
Yep.
Cool.
Through their phone. Yeah, they have a phone app. You can
Yeah.
print ID cards through their web portal. You can do a lot of stuff.
You can even use your ID card on the app.
Right.
Yeah, you don't even need a paper card. You could actually show your phone to the provider. If you need care, they'll list out providers that are local. I mean, your GPS thing, they'll tell you here are the providers within 5 miles type of deal.
Right.
If anybody has an inkling that something like that has happened to them, though, that a referral wasn't properly processed, please give me a call or shoot me an email, and I'll double check with it too, because we want to make sure that you guys aren't getting
Do
stuck
hot
with the bill.
Kaiser, so.
And you're waving, right?
No.
You're waving, you're not.
Well, I'm asking.
Why are you
the
here?
Death part about this we were talking about earlier, can I look into that?
The MetLife
Yeah,
insurance?
that's different. We're gonna get there. You're on page 8. I'm on page 4. We'll get there. So anyway, yeah, Kirsten's right. We had this come up. So if you do have a problem with a referral, really something you shouldn't have to deal with, but unfortunately some of the United providers don't do it right. So United has a lot of resources, and I only know a bit about this, but I can tell you if you go to myuhc.com, just as being a United member and Taylor providing this program, you can sign up and do little activities through their webpage. One of them is you do kind of like a health assessment form where you give them some basic information about your health, and they tell you you need to lose weight or whatever the situation is. They give you some recommendations. If you do that, you get points, and then you can convert the points into gift cards. And they have corporate sponsors like Lowe's and Home Depot and Starbucks.
Nice.
You convert it to gift cards. So they'll let you convert up to $200 a year in points. So if you do, there's several activities that you could do. If you're a smoker, there's one around quit smoking, and so there's ways you can get $200 from them. And then the big thing that's actually fairly popular is a fitness reimbursement. So there's a number of gymnasiums that like total fitness, 24-hour fitness, participate with United. So if you're already a member of that and you're going in anyway, they track how often you go in, and they do have the bar that you have to go in 12 times a month. But if you, they got a bar too. But if you go in and use the fitness club, they'll reimburse up to $20 a month for your dues.
Really?
That's your old dues, isn't it?
Yeah. So bottom line is that's available to you. It doesn't cost you anything to access those resources. So I would wholeheartedly recommend you go to the myuhc.com when you have a chance, register, and see if anything makes sense for you.
Is that a different site from last year?
No,
My UHC?
no, myuhc. I think they tweak it all the time.
Oh, okay.
The domain. This part I can't tell you how to use because I'm not good at mobile apps, but in theory, they have a mobile app version of the myuhc. So if you don't have a computer and you want to get access to information, you don't need to. You can use your phone.
It works good.
Does it?
Yeah.
Okay. So you can do a lot of the same stuff. You can find out how your claims have been processed, what the status is. You can do GPS provider search. You can